And we are following more breaking news right now. Irene, if you can give me a hand right here. CDC advisory panel endorsing booster shots for millions of older adults and other vulnerable Americans. Tonight, we're looking closer at COVID-19 booster shots on the heels of new guidance about who is eligible. Channel 3 Eyewitness News reporter Mike Savino asked health experts what they expect. He is joining us live from Hartford Hospital with those specifics. And Mike, what do they think will happen here?
Well, a lot of what they thought would happen has been happening here with the CDC votes for people over 65 and people in certain high-risk groups. So, of course, who are these high-risk people?
You can go to any of 800 sites. In that sense, we're ready.
Vaccine providers are getting ready to give out even more booster shots as more people become eligible. So who's in this group?
It's really the same group of people that we're talking about.
There are three groups of people, starting with those over 65. People who are considered high risk for COVID due to medical conditions can also get a shot. This is largely the same group considered high risk early in the pandemic, people with diabetes, heart conditions, and other problems, and people whose jobs create high risk of contracting COVID.
It's fairly vague, and I think that's purposeful.
The guidance leaves room for local and state health officials to make some decisions of their own. So how are providers letting people know who's eligible?
So there's going to be two different types of outreach, and I should say that it's a bi-directional street. So we've already had a lot of patients already contact us.
And how will we prevent people who are not eligible from getting a booster shot anyway?
We are not anticipating a onerous process for people to get their booster.
Providers want you to make an appointment the same way you did for your first two shots. But if they say we have excess supply, what's the problem if people just get a booster shot anyway?
And until we can get the rest of the world vaccinated, we're still going to see the rise of the variants.
The federal government is in the process of buying up excess doses to send to other countries in need. The hope? To boost immunity around the world and lower the chances of new variants.
Now, as we were going on air, the CDC's advisory group voted not to recommend the FDA's recommendation for frontline workers. Now, there are going to be other votes likely down the pipeline on adding to who can get the COVID shot, including kids and Johnson & Johnson booster shots. The doctors I talked with say that those both could be happening within the next few weeks sometime this fall. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.
All right, Mike, thank you. And